For those of you who have lower back pain, be it chronic lower back pain or acute lower back pain, again, always get your spine checked out. Visit your family chiropractor, visit our website, maybe we can hook you up with somebody in your neighborhood. But it's very important to see if you're physically fit, that there's no other serious matter that's going on in your lower spine that needs to be addressed. So what we're gonna do is we're gonna assume you had that clearance, and I'm gonna show you a few stretches. Lizette's gonna help me with these demonstrations so we can get you on the road to feeling more limber and losing some of that lower back pain. So what you're gonna do is you wanna start out on the floor on a soft surface, lying flat on your back, okay? So Lizette, we're gonna lie flat down on our back, and what you wanna do is bring your knees to a comfortable position, okay? Not too far up, not too far out. And the first thing we want to do is we're going to start off stretching out the lower back by using one leg at a time. We're going to get both hands and we're going to grab our left knee and straighten out the right leg straight down. And what I want you to do, as Lizette's going to demonstrate, is she's going to pull that knee all the way up as close as you can to your chest as possible. Hold it for about 5 or 6 seconds, and then let it go all the way down straight, and then reverse it and grab now the right knee and bring that all the way up to your chest. You feel that stretching in your lower back, right? Now bring it back again, switch legs, bring the left leg up, and again you want to pull it as close to your chest as possible. Now one of the modifications you could do with this is slightly grab your knee and bring it across your body. So bring it a little bit across your body, and you'll start to feel that stretch in your lower back and sort of towards the flank on the side you're stretching, and then bring it back straight across. This should take maybe about 30 seconds to a minute at the most. The next part of the stretch in the lower back is to grab both legs, okay, grab both knees up, and you just want to stretch it up to your chest and then bring it back out without letting go of your legs. Just very easy, bring it out and then bring it back towards your chest, bring it out again, and just feel it stretching. Try not to let go of it, okay? Just try to hold on to that knee. Don't make it get away, and stretch it back up. You want to do that about 10 times, and then just relax. In between, just put your feet right down to the ground and just let it relax. One of the things that you want to remember is that your lower back is a combination of many joints that are not only part of your lumbar spine, and we're going to show you that in a moment with our demo spine here, but you have a number of muscles and ligaments and tendons and then nerves that are coursing through your whole lower back. So in between your stretches and your exercises, you take a break, put your feet back on the ground. Now the next exercise or stretch we're going to demonstrate is going to be designed to directly relax some of those tight lower back or lumbar spine muscles. Again, you're going to grab both legs with the knees, and this one you got to pay attention to. You want to bring it into your chest as close as you can. And now the resistance, you want to push against your hands and push your legs out until your elbows become straight. Keep on pushing, keep on pushing, keep on pushing. So it's basically a fight between your arms and your lower back. And as you bring it close again, you let it stretch, 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 and now push against your hands. And it's going to be like a resistance. You're pushing against your knees, and it's going to be strengthening and straightening your lower back. Again, you want to do that about somewhere between 5 and 10 times. Pull it in tight and then stretch it back out, okay? Then you want to just relax like this. Now, one of the things, and we'll just use this as an example as we look at the spine, and just imagine this is how Lizette's spine is sitting in her body. The lower spine should have a curve. This is your lumbar curve. Now, what happens much too often is our abdominal muscles become weak, and it causes the curve to accentuate. Now, once that occurs, the back margins of our spine, these joints and the discs in the front, begin to become compressed. When that occurs, they inflame, and when they inflame, they can put pressure on the nerve and increase the lower back pain. So one of the things that we want to do, and we're going to demonstrate this later when we do our abdominal workout, but I just want to give you a brief heads up, and maybe you can start doing this right now, is we want to start doing an abdominal workout, okay? Now the abdominal workout, you start off with your hands behind your neck, okay? And there's 2 steps to this, and it's just a very simple crunch. It's not a sit-up, it's a very simple crunch. The first thing you want to do is tilt your pelvis up, okay? Now relax it back down, Lizette, Okay, and you saw her abdominal area move. One of the things you could do in order to test it is you put your hand, or have somebody put your hand under the small of her back, and now tilt your pelvis up, and you should feel your back sort of flatten out on the floor. That's how you know you're doing it. Now relax it back down. Now, the crunch is very simple. Tilt the pelvis up, bring your ribs to your belt. This brings your body up, and you hold it in that position. You're just crunching your abdominal area, and then let it go back down. Now, one of the big problems people do when they're doing sit-ups, where they think they're supporting their lower back, is what happens is if you go too far up, instead of using your abdominal muscles, you start using muscles in your hip, called your hip flexors. Now, these muscles are designed to pick your hip up towards your torso. The problem is that those hip flexor muscles, namely what's called the psoas muscle, is connected to the front part of your leg, or your femur bone, which comes out of this opening right in this area here, and the muscle attaches from a spot right about here to the front part of your spine. Now, if this muscle gets too strengthened or too much in spasm, it actually pulls the spine forward and can increase the lower back pain. So these 4 procedures so far are very simple procedures that we can do in order to strengthen and straighten our low back. The last thing we want to do is sort of twist the body, or sort of bring the body, the pelvic area and the low back area, in a side-to-side stretch. Okay, this allows to increase the rotation of the lower back. So you start off, you bring your leg up like this, grab both knees, okay? And what you want to do is just allow your body to tilt this way, okay? Just keep on allowing it tilt to your right, just before you feel like you're going to fall over. And then you bring it back this way. Roll it back, just before you feel it's going to tilt over. And then you come back, stop in the middle for a second, and then go all the way over again to your right, and then you bring it back. And then what you could do, even from this position, is just to make circles. You could bring a circle this way, okay? Do about 3 or 4 circles this way, and you can actually feel it rotating off the lower back. And then you stop and you bring it around the other way. Just make circles going the other way. And you'll actually feel your lower back pivot on the bottom of the mat that the floor you're working on, okay? So these simple exercises, we can relax down now, is a great strengthening and stretching exercise for your low back that will assist your chiropractor, if you have lower back trouble, in straightening out your spine.